I'm Deig. I'm a radiation oncologist. I practice out of CommonSpirit St. Anthony North and Longmont United Hospitals. I originally pursued a career in oncology because to me it felt like really a team sport. I was able to work with many other providers, including surgeons, medical oncologists, other radiation oncologists, and so forth, to really come up with the best treatment plan possible. And for me, that's the most fun part of my job is working together as a team to come up with the best treatment possible for each patient. In terms of radiation oncology, it's a really dynamic field. Things are changing constantly. We have a number of really interesting technologies at our disposal to help patients, namely to improve the effectiveness of treatment, reduce side effects, and improve the convenience. I think the best part of practicing medicine within the CommonSpirit system has been just the quality of care that patients receive outside of my clinic. Patients really feel well cared for, their providers are accessible and available, and they're able to see their primary care when they need it, present to an urgent care when they need it, and so forth. And I think we're constantly collaborating with the other providers in the hospital, outside of the hospital, and it really makes a difference when all those other issues are being managed appropriately and patients feel well cared for. I think the most critical aspect of making a decision or helping patients make a decision about their treatment is really to first get to know where they're coming from, what their values are, what they care about, what kind of things they like to do outside of work, what their social situation is, what their social support is like. And so I spend probably a third of the time that I have with patients on trying to understand those factors, because out of context, I don't think it's possible to really make a good medical decision or a sound medical decision without that information. Additionally, I spend a lot of time really educating patients, trying to empower them to help make a truly informed decision. And a lot of things that we discuss are not treatments that I actually offer. And so, I really spend a lot of time trying to, help patients understand those things and help them make the best decision possible. So what to expect in a visit with me is really just getting to know each other and trying to understand where each other is coming from, and try to find some common ground, for one. I think for two, I spend a lot of time educating patients on what condition they have, the background of it, what the biopsy results mean, kind of breaking things down as simply as possible, providing resources where patients can get more information and so forth. And also really diving deep into the various treatment options, whether or not that entails radiation and the implications of each treatment option, because it's my priority really to help people feel empowered to make a sound medical decision. Because I think without that information, people can sometimes regret what treatment they ultimately choose. And so we really try to prevent that and make sure people are fully informed of their decision. Outside of work, you can find me doing a number of things, mostly in the mountains. Me and my family, we do a lot of skiing and hiking, mountain biking, fishing, camping, and I also do landscape photography and a few other things.